Hi, Dr. Matthew Weiner from Commerce, Michigan, here to talk to you about your pre-op diet. First thing that I think is important that I say is that this is my personal pre-op diet that I use for my patients, and I recommend that all of you out there who don't go and see me, that you follow your individual surgeon's recommendations. So the first question is, why do you need to be on a pre-op diet? And I think the thing to recognize is that the thinner you are at the time of surgery, the easier for us it is to do the surgery. Specifically as it relates to the size of the liver. If the liver's large, it can fall down on top of the stomach and make the surgery difficult for us. But even more commonly, if the fat, the abdominal wall fat is very thick, or the fat inside the abdomen is very plentiful, then it can make the surgery a little harder on us. And by you dropping 15 or 20 pounds before surgery, that can help us perform the surgery easier. If it's easier for us, it's going to be easier for you. So this helps us do the surgery better with a lower complication rate, and it really is a uniform practice across the country. Most pre-op diets, including most of mine, uses an artificial commercial protein shake. And we have several criteria in our practice. I prefer whey protein as opposed to soy. I recommend that it has at least 15 grams of protein, less than 4 grams of sugar, less than 200 calories. And in fact, most commercial protein shakes will meet these criteria. I do not have my patients do protein bars. Protein bars are generally candy bars with whey protein added, and this I don't think is an adequate way for us to get you to lose weight before the surgery. So popular shakes like Untitled, Atkins, EAS, Pure Protein, Premier Protein, these all meet these criteria, and really it's a taste preference issue for you to find the one that you think works the best. I don't have a strong opinion on one of these over the others. Now we have two different diets depending on your gender and on your size. So for female patients with a BMI less than 50, because women tend to be shaped like a pear, where most of their weight is in their thighs and in their buttocks, their abdomen tends to be not very fat, and in fact it's pretty easy for us to do these surgeries on women with a BMI under 50. I may in my office see a female patient who doesn't have the traditional pear shape but has shaped more like an apple. Oftentimes this is a diabetic patient, and I may in fact flip her over to the 2-week pre-op diet as opposed to the 1-week pre-op diet. But for those patients who I think are low risk for having a fatty liver, and I think the surgery won't be all that difficult, I don't emphasize that you go on this 2-week starvation diet. I don't think it's all that critical. So you can have a protein shake for breakfast and lunch, and then for dinner you can have something like a lean cuisine or a healthy choice meal that's about 400 calories or less. If you like, you can take your bariatric multivitamin. If you don't have to until after the surgery. Also in this group of patients, I use our Pound of Cure Metabolic Reset diet as an alternative. And many patients use this instead because you feel a little better. It's much more in line with the way you're going to eat after the surgery. And in fact, you've been in our pre-op program, so you're familiar with it and have been eating like this for the last few months at least. So many patients elect to have the Metabolic Reset diet during this period, and I think that's fine. For male patients, because men tend to be shaped more like an apple with their fat inside the abdomen, which is where we're going to be working, or for female patients with a BMI over 50, we recommend a 2-week program. For women, 50 grams of protein a day. For men, 60 grams of protein a day. You can have as many calorie-free liquids as you like. You can have as many green vegetables as you like. I recommend you take your multivitamin. And for many patients, I recommend that you take a fiber supplement like Metamucil, a sugar-free Metamucil, because you're not eating any other food other than the protein shakes, the calorie-free liquids, and the green vegetables. And oftentimes you can run into some constipation, and the fiber supplement can be helpful. So you'd go on this for 2 weeks, and the Metabolic Reset diet is not an acceptable alternative to this diet. The Metabolic Reset diet is a great diet for long-term weight loss. In this, we're looking for short-term weight loss, and I think that by severely restricting your calories, that's the best way to lose weight over the short run. It's the worst way to lose weight over the long run. If you're a diabetic patient on either of these two programs, You should be real careful to check your sugars, and you may need to touch base with your primary care or your endocrinologist or whoever doses your insulin and adjust it accordingly, particularly if you're in the 2-week very low calorie protein shake diet. And the last thing I'll say about our pre-op diet is that I fully acknowledge that this calorie restricted diet completely goes against everything I've been teaching you over the last few months. However, our goal is for short-term weight loss. We're trying to get you to lose as much weight as possible right before the surgery. I don't worry about you keeping this weight off, because then we're going to do the surgery, which is going to drive additional weight loss. So for short-term weight loss, we look for very low calorie diets. I think the protein shake form of a very low calorie diet is the most tolerable way for you to do it, and it works well, but it does not in any way, shape, or form represent my opinions about the types of food you should be eating over the long run. Over the long run, you should be eating the fruits and the vegetables and the nuts and the seeds and the beans, because that's what drives weight loss over the long run. But for the pre-op diet, we're just looking for weight loss over the short run. Our website is www.drmatthewweiner.com. If you have any questions about our long-term weight loss program or our long-term post-bariatric surgery weight loss recommendations, you can pick up a copy of my book, A Pound to Cure, or check out our Facebook page or our growing YouTube channel. Thank you.